I call the member for Ryde.
Thank you, Speaker. I appreciate the call and welcome all of you into the gallery. I know it's for a later item, but I hope you enjoy your time here. And he's always a great speaker for explaining the process while it is on, so I acknowledge you for that. And I thank the member for bringing the motion. It is good that we have been able to have a debate in this time that has been allocated, and of course very supportive of the motion and the funding for women's health centres. I represent a particularly diverse, multicultural community, one of the highest, in fact, anywhere in the country and in the state. And one of the things that I've observed in my time, both in this role as the member for Ryde and preceding that as the Mayor of Ryde, was a misalignment between cultural diverse groups and access to support services that places like women's health centres provide. And this is why I wanted to rise and speak on this issue, because we know, and we have heard in the news of late, that it is essentially an epidemic of domestic violence and family abuse that is being experienced right across this country, and I would hazard right across the world. We are fortunate here to have relatively good levels and standards of reporting, and so probably can reflect and acknowledge the extent of that issue here. I truly do lament for people living in jurisdictions where they don't have that transparency. But one of the things that the women's health centres do is bring together that very important piece, that cultural awareness, support and assistance in language, an ability to bring people from communities who may not feel as at home in Australia as people that were born here and have grown up, and ensure that they are still able to be connected to services just as the rest of us should be entitled to do. I had a look on the Women's Health Centres New South Wales website, and for the benefit of the gallery, I'll go through where a number of these services are. They may even be from an area that you're from, but Bankstown, Blacktown, in the Blue Mountains, up on the Central Coast. I know the member for Terrigal was here earlier. The Central West, in Coffs Harbour, Cumberland, Fairfield, Hunter, the Illawarra, and I know that the members are here represented for this discussion, in Leichhardt, Lismore, Liverpool, Penrith in Western Sydney, the members here, South Coast, of course, Sydney, where we are located now, Wagga, and Albury, Wodonga as well. I think that gives you a bit of a demonstration of the breadth and the spread of these services, and so of course any additional funding is hugely valuable. But one of the things that I'd particularly like to use this time to bring to the House's attention is the importance, the utmost importance of prevention. We spend a lot of time talking about acute services, and of course they're extremely important for women that are trying to escape family and domestic violence. Getting them out of that immediate harm is, of course, an absolute priority. It's the most important thing we can do. But there is so much more we can do if we can identify trends and problems before they get to that point. If we are able to identify at-risk cohorts, engage them with services early, help them to get on their financial feet, to help them to make arrangements for school, for their children at school, to ensure that if they are at the point of leaving an abusive relationship, that they are never one of the unfortunate but far too overrepresented groups of overwhelmingly women that find themselves coming back to an abusive relationship. And of course that happens because it's very simple. They run out of money. They don't have shelter. They're unable to get their kids in school new pair of shoes or a school bag. Or of course the abuser comes after them and coerces them back. They are horrendous outcomes for any person, because when you go back, the abuse often becomes worse. The perpetrator feels as though they have lost control, that they can't tell you what to do and where to go, and so the cycle continues, and it can have very devastating consequences. So one of the things that I've been doing a lot of advocacy on in my electorate is support for a fabulous organisation called the Northern Centre. They are not specifically a women's health centre, but there is a lot of overlap with their services. The Northern Centre has a program called Safety, SAFET, and it is designed to identify and catch people early and get them out of the cycle of abuse. And I acknowledge the Shadow Minister, who is here and in fact has been to Ryde and has met with the Northern Centre and their CEO, Kate Sinclair. This program is one of the few, I should say, that is really targeted and has also been is evidence-backed. The Macquarie University, with funding from the City of Ryde Council, which I was pleased to support in my time as Mayor, has actually done research into the success and effectiveness of this program. And the results are very clear. It's oversubscribed. More people want to access it than it has capacity for, and it is helping people escape that cycle. And so my message for this Parliament and for the government and for the Minister, if she is listening, is to please consider funding for that organisation as you have done for the women's health centres. Because in my electorate, I don't have a women's health centre. The Northern Centre is the next best thing that we have, and it is extremely successful. It is culturally sensitive. It is trauma-informed, and it is making a real difference for men and women, but obviously mostly women and their children. So I thank the member for South Coast for bringing the motion. I'm very pleased that she's had success in the budget for this particular initiative. I think there is an enormous amount more that we need to do. It's been great to see this issue be on the agenda and a centre point for not just our state's debate, our national debate. We've seen hundreds of millions of dollars in federal budgets as well, and that is the start. There is a long way to go, but my message, my very, very clear message, is that it cannot be an acute-only debate. It has to be a prevention and an acute debate, because in the long run, we save a lot more lives, we reduce the level of hardship, and we improve the quality of life for far more people if we can avoid them ever getting into a circumstance where they need to rely on a service like a women's health centre. So the more we invest in that, the better. I commend the motion, and I encourage a whole lot more work, advocacy and investment in this space.
I thank the member.